Forensic mental health is a field of study where we work with students to develop their skill set at the intersection of law, criminal justice, and behavioral health, psychology, sociology, that kind of thing. As most people probably realize at this point in time, that intersection has become just a hotbed for activity. The need to have science inform practice is highly important right now in that area of our communities. We like to call our students boundary spanners because they can talk the language of all of those professions in a way that's much more effective in helping folks that tend to have mental illnesses and become involved in the criminal justice system. Anywhere from 20 to 40% of the students that are also students returning to the classroom after years in practice in certain fields. So it's an eclectic mix of folks and experience levels and types of experience in general that actually end up taking the courses. It's so invigorating and exciting, particularly at the graduate level. I mean, really when you're in the classroom with students that are performing at that level, we're really learning from each other because everyone brings a different experience set to the room. First of all, we're one of like 3 programs across the country that actually does this. So we're a very unique program. A lot of schools provide the opportunity for a forensic psychology degree, which is a more clinical degree, but there's a lot of people that aren't interested in pursuing a license and doing counseling or doing therapy. They really want to work effectively at this intersection, but they don't want to become a clinician. All of them have said that the work has prepared them for excelling in their workplaces, for working with peers, working with the clients that they end up working with very consistently and creating a really a good breadth and depth of skill set that allows them to be effective. We typically see students that come either through the psychology, sociology route or through law enforcement, criminal justice. That tends to be the majority of them. That being said, we've had quite a few students that have come into the program. One of them had a marketing background. One of them had an English background. Even for folks that may not have an undergraduate career that is, at first glance, one that you would think would go in that direction, they've been quite successful in the program. We have 2 attorneys that actually teach the legal classes. One of them actually works for a local judge here in Albany. The adjuncts that we have working have wonderful experience in the community working at somewhere at this intersection. You have people that are in the field that are in the classrooms teaching the material, which just brings so much more to the experience, and because we have real life experience to kind of bring to the table. I think this is a field that has to grow. We're seeing more folks in law enforcement learning the need to increase our scientific understanding to become more effective in that field. And that requires, a scientific understanding of what's going on with folks, how to intervene with them in a way that's much more effective. A program like this is exactly what will allow anybody working in that industry, whether it be through law enforcement or case management in a reentry program. They understand the complications that come along with a mental health diagnosis and getting treatment and being able to meet the needs that are there for somebody that has those conditions. It's difficult. Being able to maneuver that system in an effective way is not something that you learn in a lot of programs.